Finding Hope, the road to recovery.
What are some ways that we can kind of help, do you guys think, in collaborating and involving the families and helping them with their loved ones that are struggling with the disease?
Well, one of the things is in our avatar group is family significant other interview.
Yeah.
Where we're mandated to actually reach out to the family members if they want to be involved and if the patient will allow this.
Yeah.
You know, I recently had an initial session with the patient, and the patient had agreed that her daughter be involved. The patient is elderly, you know.
Yeah.
And it really helped the patient stay focused.
Yeah.
You know, because sometimes she would act out, and I would let her speak her piece and speak her mind, and I would meet her where she's at.
Yeah.
I said, you know what, let's call your daughter and see what your daughter thinks, because she wanted to leave treatment.
Oh, yeah.
You know,
Yeah.
we placed that call together, and the doctor was able to talk her down and to remind her of her commitment to treatment, because now she has grandchildren.
Yeah.
You know, and the daughter wants her to prepare her mother to be a part of her child and the grandchildren's life now.
Yes.
You know?
Yeah. Go ahead.
I think, you know, I have two things to say. One is, you know, I had a friend whose son continued to relapse and go from treatment center to treatment center. And I kept suggesting that to my friend that she tried to go to Al-Anon, which is a program for the person that does not use the drug, but is affected by the drug. And finally, after my friend called me so many times about her son relapsing, I finally said to her, how can you ask your son to do what you yourself aren't willing to do? Go to that program, work those steps, and find out your own answers. And she has gotten like clean, you know, off of the addiction that her son has, right? So she's done that. But the other thing that I also try to do with my patients is to right size their expectations of their family members. Because a patient is sitting in front of me, and whether they're there, you know, by their own volition or the nudge of a judge, they are actually actively engaged in their program. And sometimes their expectation that their family member should be right there with them is false hope.
Yeah.
And so trying to manage and work with them to try to right size it.